Before you decline hydroxyurea because you've heard it's a chemotherapy drug, allow me a moment to explain a few things that you probably aren't aware of. I'm a former doctor, I have sickle cell myself, and I've taken hydroxyurea for the past 10 years. This myth that it causes cancer goes all the way back to the 1950s when it was first discovered in the lab to block DNA replication. However, this finding got translated publicly to say that it damaged DNA, and therefore people jumped to the conclusion that it could cause cancer. This rumour then caused more fear and confusion when it was approved for use as a chemotherapy drug in certain types of leukemia in 1967. But the key piece of information missing here was that in cancer treatment, the goal is to damage or block DNA replication in already cancerous cells so that they can't spread. This has nothing to do with causing cancer. So then we jump to the 1980s and we find that hydroxyurea has the potential to increase the levels of fetal hemoglobin, which is extremely beneficial for treatment in sickle cell disease. So hydroxyurea is trialled at a much lower dose and is found to reduce sickle cell crises, blood transfusions, and acute chest syndrome. And now 30 years following this, long-term studies have found no increased risk of cancer in sickle cell patients. So I hope that reassures you and helps to debunk the myth. I personally find it very reassuring and will continue to take hydroxyurea. Feel free to comment your own thoughts or questions below.